I want to affirm one basic fact that health, as we say in Kenya, is not a privilege for those who can afford. It is a right for every citizen. Rights, however, matter not when they are proclaimed on paper or in theory, but when they are realized in practice. This is why Kenya places people, communities, and their voices in the very heart of health governance. Distinguished delegates, social participation is the bridge that connects policy to people. It ensures that communities not only benefit from health services, but also help shape the decisions that govern them. It is in this spirit that Kenya strongly supports the World Health Assembly resolution on social participation and social connection in 2025, which we view as vital instruments of transformational governance and inclusive development. When communities participate in health decisions, three things happen. First, policy becomes responsive to real needs rather than remote directives. Second, accountability and transparency flourish as citizens can follow and track how resources are used. And three, health systems grow stronger and more resilient, trusted by the very people they serve, especially the most vulnerable. In Kenya, this is how we ensure that expectant mothers has access to essential antenatal care, that every child receives life-saving vaccines, and that families are supported in confronting the rising burden of non-communicable diseases. Ladies and gentlemen, Kenya's commitment to social participation is firmly anchored in both law and policy. Our constitution guarantees the right to the highest attainable standard of health on one hand, and the right of citizens to participate in governance. Both are constitutional imperatives. The Public Finance Management Act embeds citizen input in budget making, including in health, while in the Health Act outlines mechanisms for community engagement in service delivery. We're also aligning policy with action. We recently enacted 4 transformative laws to drive universal health coverage reforms. And why I say we had to change the whole architecture around law to be able to make health much more responsive. The old law had no place for people. The old law did not give voice to the vulnerable and to the people at the margins. And that is why we had to change the legal framework completely